Good day, everyone, wherever you are, and thank you for tuning in to this webinar entitled openIMIS and Medical Education, incorporating openIMIS in San Beda University's Doctor of Medicine program. In this particular webinar, I hope to share with you my journey, the experiences, and of course, more importantly, the lessons learned in introducing, testing, and using openIMIS in a Doctor of Medicine academic program. Now, let's begin. The openIMIS is the first open source health information technology for the linking of beneficiary, provider, and payer data. openIMIS aims to link health financing schemes into an interoperable digital health systems by using open source software. Now, openIMIS is currently being implemented in a lot of countries. I'm actually losing track already of how many countries they are being implemented in. But these include countries like Nigeria, Tanzania, Nepal, and Bangladesh, and is currently establishing a community of practice or COP for openIMIS users here in Southeast Asia. Now, San Beda University College of Medicine is situated in the city of Manila, Philippines. And we as a university, and particularly as a college, collaborated with AHIN to include San Beda University as part of the openIMIS Regional Community of Practice openIMIS Regional Community of Practice way back in January 2020 when everything was sane before the event. And this was facilitated through on-site trainings. An initial implementation project roadmap was proposed in 2021 with the objective of providing support in managing the country-level strategies of the openIMIS community of practice here in Asia, particularly through engagement with and participation of our faculty and students in the openIMIS online course and test cases. Here are some pictures. Now, volunteers care of our college student organizations such as the Pulse, as well as several faculty from the College of Medicine, were also engaged in the subsequent openIMIS case testings. Now, in academic year 2021 to 2022, the students of the Tropical Medicine course, it's an elective course here in our college, they participated in the Swiss Tropical and Public Health Institute openIMIS e-learning course, which was supplemented by the 2022 version of the manual openIMIS training program for medical students in the Philippines. Now, due to this particular activity, post-activity feedback of the course and openIMIS in general was done through both polling and focus group discussions from the participants. Now, the participants in the evaluation found the course to be informative and relevant in their experience because it covered topics not extensively addressed in the medical curriculum, at least at present. And these topics include particularly health financing. Now, for many, this was very new and valuable addition to their education. However, some noted that certain terminologies used in the course were not localized to the Philippines, and this spurred a suggestion wherein there's a need for additional localization support and resources to enhance their understanding. Discussions during the FGDs also highlighted the potential for incorporating openIMIS directly into the San Beda University College of Medicine curriculum. Participants felt that health information technology, such as openIMIS, would be most appropriate for inclusion in specific courses from the program, particularly health management courses or within the family and community medicine module or the FCM module or the FCM course. Health financing, which is a key health financing, a key component of openIMIS, is currently not widely taught in medical schools here in the Philippines. But the students, our students in our college, recognized its importance and recommended its inclusion in the mainstream curriculum, especially when they reach third year, wherein they get greater clinical and community exposure. It was also floated that the practice of medicine course, which was relatively new course way back then, it could also serve as an appropriate platform where health financing topics could be taught where openIMIS could be also integrated as a practical tool. Now, finally, a large portion of the participants perceive the course as highly useful for general practitioners. Now, this is very important because, of course, we are training our students to become eventually general practitioners and eventually specialists in their own field if they so choose. Now, the college activities with openIMIS, including the latest activity feedback and roadmap, now these serve as key foundations for the next step in integrating openIMIS into the medical training program of our college. Now, starting in October 2024 last year, San Beda University, in partnership with AHIN, established a project with the aim of incorporating openIMIS in the Doctor of Medicine program of San Beda University College of Medicine. Now, here are the project specific objectives: identification of the possible integration points of health information systems, which includes health financing software such as openIMIS, into the medical curriculum. The second one would be discussing the use and importance of health information systems and health information technology in healthcare delivery, demonstrating the basic use of openIMIS to our students, and critiquing the usability of openIMIS as a tool for future medical practitioners. So let's take a look at the project activity design. So the project started with phase one, and particularly phase 1A, which was a review of our current curriculum specifically regarding topics on health financing and electronic health records. Phase 1B continued with the generation of updated openIMIS scenarios to be used in phase 2. Now, to give you an idea, the 2022 version of the openIMIS training program for medical students here in the Philippines was used as a guide in the crafting of these scenarios. We just updated the scenarios from that technical manual. Phase 2 of the project then started with a short introductory webinar presentations. I think some of our participants here also attended that webinar presentation. And this was immediately followed by a hands-on practical demonstration of openIMIS. Phase 3 of the project was the evaluation of openIMIS as a health information system and its applicability to be incorporated within the formal medical curriculum. This phase 3 in particular, I forgot to click. So phase 3 in particular used the system usability scale. It was developed by Brook and Lewis. So as a quick summary, the system usability scale, or SUS, is a 10-item Likert scale. It was initially developed in 1995. It has been widely used, and it's noted to be a standardized questionnaire for the assessment of perceived usability of technology. It's a very simple 10-item Likert scale. It involves questions about a system's complexity, its ease of use, technical skill barriers, and of course, all of the other constructs here shown on screen. Now, scores for each question do not normally stand on their own, but the composite score for the scale has been well validated across multiple studies. Now, the scale, as well as its many variations, have been routinely used in many instances of technology evaluations and validation studies. Now, for this project in particular, the scale was framed in the context of using openIMIS as a general practitioner within the Philippine healthcare setting. So let's look at the project findings. Okay. For phase 1A, the specific courses that were reviewed were courses where public health topics were usually involved. Of course, these courses for the San Beda University College of Medicine participants in the group, you will be familiar that these topics would include these courses would include the Family and Community, or FCM course, as well as the Practice of Medicine course. Remember that these were also the courses that were identified as possible integration points way back during the 2022 FGDs, or focus group discussions. The relevant activities from these two courses were then triangulated with the key health informatics and health financing topics identified in the 2022 openIMIS training manual, and particularly the sections 1.1, or the WHO Health Systems Framework, and 1.2 overview of health financing and health systems. These were these topics were also triangulated with the Universal Healthcare Law of the Philippines provisions, particularly the implementing rules and regulations, wherein health information systems are actually mandated to exist across the across all healthcare facilities in the Philippines. Now, to give you an idea regarding the possible integration point courses, the Family and Community Medicine program includes four courses: FCM 1, FCM 2, 3, and 4. And these are delivered across each year level. Now, the Philippine Healthcare Delivery System and the Universal Healthcare Law are also introduced in FCM. This is reintroduced and reinforced from FCM1 to FCM2, even up till FCM3 and FCM4, where the six building blocks framework and the current Philippine healthcare situation are discussed. Now, specifically in FCM3, there are discussions on organizational structures, health policy development, health sector reforms, and the universal healthcare law. There is an activity specific for health economics and the Philippine health financing strategy. Now, of course, FCM4 is community rotation. So if you are familiar with medical programs, this is where our students go into the communities to perform primary health care and also do health management and community related and family community medicine related activities. Now, the practice of medicine is a series of three courses: POM1, POM2, and POM3. And again, similar to FCM, these are delivered across each year level. The courses, these courses tackle a variety of topics. And but mostly, in a nutshell, these discuss the necessary skills and competencies required for a doctor in their practice of medicine as a profession. So it's a very broad um, topic list for the three courses of practice of medicine. Now, in the POM courses, non-clinical competencies such as there are topics on telemedicine, health information technologies, data privacy, health economics, and the universal healthcare law. These are again introduced. There is also a focused discussion on the World Health Organization, international healthcare systems, and the Philippine healthcare system, including the role of the Philippine Health Insurance Corporation, or PhilHealth, which is the country's primary health insurance provider. So as you can see, there are a lot of intersections between the topics of family and community medicine and practice of medicine courses, wherein health information technologies and health information systems such as openIMIS can be incorporated in. The 2022 openIMIS training program for medical students in the Philippines is a module. So I've been talking about this earlier. So just as an introduction, it is a module specifically that introduces students here in the Philippines um, to healthcare systems, health information systems, health financing, data privacy, and digital health initiatives, such as electronic health records, and of course, openIMIS. The last part of this module, entitled Interfacing with openIMIS, it contains topics that introduce students to openIMIS, its primary uses, and key features. Lastly, the module contains a simulation session which aims to let students access the live demo server of openIMIS using three different perspectives and tasks: as enrollment officers, as claims administrators, and as claims reviewer. The student guide, or the scenarios that I mentioned in the project briefing earlier, was updated based on the findings of both the 2022 FGDs and Phase 1A to ensure that identified gaps in the curriculum were also given more attention. So we tried to personalize the scenarios to fit our current student population and their needs and the current program of medicine curriculum. Phase 1B of the project focused on creating a step-by-step student guide that introduces medical students to the features of openIMIS that are aligned with their training as physicians, as outlined in Phase 1A of the project, I believe. Now, specifically, the outcomes of Phase 1B are as follows. So the participants should be able to log in. Definitely, they need to know how to log in, particularly to the openIMIS demo server. Of course, using administrator demo credentials. The second outcome is as enrollment officers, participants should be able to appreciate the structure of health insurance enrollment by enrolling a new family member as an insuree, as well as identify the information needed to enroll a household in an insurance scheme. The third outcome would be as claims administrators, wherein participants are tasked to create medical insurance claims by the new insuree that they just enrolled, uh, the insurance claim coming from a health facility, and as well as to identify information needed to process medical insurance claims. Now, the third outcome would be as claims reviewers. And the outcome for this phase is a little bit shallow. The participant should be able to at least appreciate the multi-step checks and balance processes involved in medical insurance claims. Now, I'm sharing on screen a sample of the updated student guide. For each phase 1B outcome, there is a general scenario which puts users into a role playing mindset where a short storyline is provided as a general scenario. Now, in a nutshell, the scenario assumes that, of course, our users in this case would be medical students. Uh, the scenario assumes that they are already general practitioners working as doctors. Number one, working as doctors, as well as openIMIS users as part of their work, hypothetically in a community health insurance organization called SBCHI. As a short segue, community health insurance schemes or cooperative health insurance, locally called co-ops here in the Philippines, are relatively common here in our country, especially in rural areas and among workers in the informal sector. As San Beda College of Medicine, our students rotate in rural communities and urban poor areas, making this scenario quite relatable to them during their community rotations. And of course, once they become physicians, if and when they get to practice in these types of communities and population groups. The student guide then asks the student to act as enrollment officer, claims administrator, and then claims reviewer. While asking them to perform all of these three roles may not be optimal, this may be somewhat realistic in poorer communities where insurance workers, or at least workers who work in insurance uh, cooperatives, may need to do some multitasking. So, this is, of course, a reality in low middle income countries. And besides, this provides education for the medical students about the practical processes happening from insurance enrollment to claims processing, and see where the main function of physicians come into play in the entire health insurance process. So hopefully they get a taste of how their role as physicians get paid at the end of the day. Okay, so I'm just sharing some screenshots from the phase 2 of the project, the openIMIS live webinar and demonstration, which was delivered online via Zoom. It was attended by 124 unique attendees. The attendees were mostly year level 2 students of the college, but there were a few year level 3 students as well as some faculty members. The webinar lasted for around 49 minutes. At least the introductory presentation lasted for roughly 50 minutes, while the live hands-on demonstration lasted for around 35-36 minutes. So just to give you an idea on the length of the webinar and the live demonstration. Phase 2 of the project started with a short introductory webinar presentation on health information systems and the key features of openIMIS as a health information system. A summary of the results of the phase 1 or the triangulation, the curricular review was also shared to the participants as the previous openIMIS activities for better context. The webinar was immediately followed by a hands-on practical demonstration activity using the live openIMIS demo server, um, which used the updated scenarios from phase 1B. Now, as limitations, there were some server side technical problems that arose during the demonstration. Um, Maybe it had something to do with the live updating of the demo server as well as the live server of openIMIS during that particular time wherein we were conducting the live demonstration. But overall, we managed to troubleshoot it and the live demonstration proceeded as planned. Now, for the demonstration, I shared the openIMIS demo server. Um, I shared the demo server screen while I was reading each scenario, and we followed instructions from the phase 1 guide. I also shared the steps from the guide so that the students can follow each step easily. So as you can see, the photo on screen, this is a snapshot of what the students were able to see. It contained the actual screen sharing of the live demo server as well as the instructions underneath. So the audience were encouraged to actually follow the demonstration and try out the demo server by providing the demo server admin details for them to be able to log in. The prologue was also discussed. So the prologue putting the scenario into the mindset of the students. So the prologue was discussed to put the students in the proper frame of mind of a general physician and an openIMIS user at the SBCHI Health Insurance Cooperative. Of course, this is the theoretical health insurance cooperative for the scenario. Now, on the right side of the screen, as enrollment officers, the students were tasked to enter the details of a new SBC insuree. And I named the insuree Mr. Juan Mendiola. I use that particular name since Juan is a prototypical name here in the Philippines, while Mendiola is the street where the university is located in. Now, the idea was to make the scenario catchy to our students, and of course, while showing the enrollment process in openIMIS. So as you can see, the steps of enrolling an insuree are here on the right side of the photo on the right side of your screen underneath the openIMIS shared screen. Now, after enrollment, the scenario continued that Mr. Juan Mendiola needed a consult. So that is the scenario. And the students were tasked to act as his primary care physician. Now, this is not part of the original openIMIS process demonstration, but this is very crucial because it acts as a bridge between insuree enrollment and claims administration. This also highlights the primary role of our graduates, wherein they will need to play the role of general practitioners when they graduate. So this step was particularly important and practical for them. Now, as claims administrator, I think on the left side of the screen, the students were then tasked to create a claim for Mr. Mendiola using services and items from the openIMIS server. I think I gave Mr. Mendiola, I think it was typhoid, and the services that were requested were general typhoid arthritis there. So that the case of Mr. Juan Mendiola was of typhoid arthritis, and the services that were requested were general consultations and I think an elbow x-ray. As claims reviewers, the students were then tasked to process the health service claims of Mr. Mendiola. This involved claims review, valuation, and approval of services and items, and then feedback delivery. Now, I would have to admit there were some limitations that we encountered there. Some of the functions, particularly feedback delivery, there were some errors that we encountered in the demo server. But that being said, these shortcomings were just verbalized to the students at the last part of the demonstration during the epilogue. Now, as a final cap for the scenario, the epilogue contained a summary of what the students should have experienced during the demonstration. The epilogue also included a basic summary of the processes that eventually enables health insurance to pay for doctor services because, of course, this is a very realistic and a practical concern of doctors. And this is very important in our use case as our students will expect to be paid for their future services as physicians and not necessarily as openIMIS administrators. So bridging this gap between practice and expectations is demonstration, practice, and expectations would be very important for our students, at least in our students' use case. Now, the last phase of the project was the evaluation of openIMIS as a system. The evaluation phase made use of a Google form provided to the respondents and collected a few general demographic information that immediately followed by the 10-point, 10-item SUS Likert scale. There were a total of 106 completed responses for the survey, and a large majority of the respondents rated their technical skill as either 4 or 5 out of 5, which is actually quite high. At least these are self reports of their technical skills. Well, surprisingly, a small number of respondents have had previous experience using openIMIS in some capacity prior to the session. So this was another surprising finding was that more than a third of respondents have used a software or program that was similar to openIMIS in their previous studies or their previous professional experience. Now, according to a systematic review in 2019, only a handful of studies have investigated the use of electronic health records and similar systems in medical education specifically. And these studies were done mostly in North American schools. This shows that there are still important gaps in medical education, particularly in health information and health information systems and health information technology, particularly here in our country. Now, the average openIMIS SUS score from the participants is about 68. This is a score of 68 out of 100 from the SUS scoring system. This suggests a letter grade of C and a percentile range between 41 to 59, according to a study by Kortum and Bangor in 2013. Now, I know those numbers don't really, you don't really know what those numbers mean, but for reference, Microsoft Excel has a score of 56.5 and a letter grade of D. I know a lot of you might cringe. Microsoft Excel for most people is a very difficult program, very difficult software to use. It has a grade of 56.5 and a letter grade of D. While Google Search, which is a very user-friendly, let's call it a user-friendly interface, it has a score of 92.7 and a letter grade of A+. But that's why a lot of people, including those who are not technically savvy, they can use Google search quite easily. So in short, at least for San Beda medical students and those who answered the evaluation, openIMIS rates somewhere in the middle between Microsoft Excel and Microsoft Word. As you can see here, I also shared Microsoft Word here with a score of 76.2. So openIMIS ranks somewhere in the middle. Now, the chart on screen summarizes the scores of each SUS question in the context of current medical education and practice here in the Philippines. Now, the notable results, which are highlighted in yellow, were that number one, the respondents did not find openIMIS awkward to use, which is good. Number two, the respondents did not find too much inconsistency, which is also good. Number three, the respondents found openIMIS functions are well integrated. Number four, the respondents found openIMIS easy to use. And number five, the respondents found that they would like to use openIMIS frequently. So all of these, at least five notable results that I mentioned, were positive for openIMIS. Now, in order to achieve a greater SUS score, there were two main concerns that need to be addressed. And these include participants need to learn a lot of things before they can use the system. And participants, at least they think so. And participants also think that they need the support of a technical person to be able to use the system. Now, the latter issue is very consistent with one comment which stated that openIMIS was hard to use that needs IT professionals on call. Now, in a recent study, I think it was a commentary by Chung et al. 2025. They cited technical support delays as one of the challenges faced by the Philippines in terms of health information management. Now, lastly, there were several comments during the webinar suggesting the possible utilization of similar technology here in the Philippines, particularly electronic health records and health insurance systems. As a background, the 2019 Universal Healthcare Law requires all health service providers and insurers to maintain a health information system which covers health records. The same study by Chung, which I mentioned earlier, 2025, Chung et al. 2025, they also mentioned that only about 50% of local government units here in the Philippines have allocated budgets for such systems. So we really have a long ways to go. So I will be concluding my talk. So in conclusion, the San Beda University College of Medicine program has two primary courses that might be able to contain topics and activities related to health insurance systems, family and community medicine, and practice of medicine. At present, these courses touch on these topics on a superficial level, but there are no specific activities related to the use of such health information technology and health information systems. The project was also able to create updated openIMIS scenarios for medical students in the Philippines for use with openIMIS demo server or even the live. Okay, let's not touch the live server. So openIMIS demo server at least, or if we have our own in-house server, it can also be used then. Medical students from the university also rated openIMIS within the 59th percentile based on the SUS scoring system. The respondents found openIMIS easy to use and well integrated, and the functions are very usable, but the main issues raised were that for need for proper usage training as well as dedicated IT support. Now, lastly, as an update, it was a pretty buzzer beater update for this webinar. We were able to get the commitment of the practice of medicine coordinator to formally incorporate the activity, particularly the live demonstration and the usage of the scenarios, into their syllabus for the next academic year. The upcoming academic year, 2025-2026. We are optimistic that this step will be formalized. And when we say formalized, these will be at least this activity will be written in the upcoming syllabus, since we are still finalizing the syllabus for the next academic year in the next upcoming months. And I think that ends the session. Thank you very much for your attention, and your questions are very much welcome.
Thank you for sharing San Beda College of Medicine's journey in integrating openIMIS into your academic program, Dr. Julius, and congratulations on that newest update. Now we would like to invite our attendees to send their questions in the chat box. Mics are also enabled in case you'd like to ask directly. While we're waiting for questions, maybe we can give some time for reactions from our openIMIS focal points. Maybe we can start with Dr. Chamika first.
Hi everyone. Hi Julius. Congratulations, and I'm really impressed about your work. So one of my question is could you elaborate on the technical process and the stakeholder engagement strategy employed to develop the localized openIMS scenarios for the, sort of like clinical skills lab manual, particularly ensuring their alignment with the PhilHealth claim flows?
Thank you very much for your question.
Yeah.
The scenarios, we are lucky that during our first workshops with AHIN, we already have a training manual specific for medical students. And this particular the 20, I think from my presentation, the title was a 2022 openIMIS training manual specific for medical students. And there are several scenarios already incorporated in them which demonstrated the three functions that I mentioned in my talk. So these functions and these scenarios were localized better for our students because most of the functions from that training manual were more administrative in nature, and there w- and the inclusion of the scenario, particularly um, giving examples of practical examples of the enrollee and the scenario itself, and the health insurance, the theoretical health insurance system. So these were the added information that were updated from the previous training manual. Now, as far as what are the competencies that were needed to be incorporated for in the localization in the updating phase, um, we use the universal healthcare law, um what do you call this, the implementing rules and regulations, wherein the functions of a medical graduate, um in the what do you call this, in the implementation of the UHC law, um these were triangulated with what competencies were already present in our medical curriculum. So there are a lot of documents that were triangulated to make sure that the scenarios fit the current program of medicine curriculum as not dictated, as suggested by our Commission on Higher Education, and to make sure that it also applies in the fulfillment of the universal healthcare law, and also in the in to make sure that it also fits in the current program of medicine from our university. So basically, it is a triangulation of multiple documents. That's why phase 1A, the review of documents, was very important, even in the updating of the scenarios. I hope I answered your question somewhat.
Yes. Thank you so much, Julius. I just have another question. I'll just put it on the chat box. So if it time permits, you can answer that. I think let's give others a chance as well. Thank you.
Thank you, thank you.
Yes, thank you, Dr. Chamika. Maybe we can also call our focal point, Professor Basanta.
Thank you very much, Christian. Uh, yeah, Dr. Julius, that was a really nice presentation. So with this type of initiatives will encourage, I think, doctors to also know about the IT systems and all these things. So I'm adding the questions regarding the same topics, like in Nepal. Currently, in Doctor of Medicine courses, they have not yet, in one of the university, they have started health informatics course, and they are adding openIMIS as one of the module. But in other places, they have not added. So my question is, are you like planning to make it as I think Dr. Elvin has asked similar questions in the chat box as well. So how you are planning to conduct the course? Will it be a part of another course, or it will be like or the different course? You need to assign a separate time slot for conducting that type of course.
So thank you for the question. Actually, I right now we don't have the, I think, from our program, we cannot really assign a specific course to handle just specifically on health informatics. I believe that that is not in our, at least in our near future. So that's why this particular activity would have to be piggybacked into another course. And that is why the identification of where we can piggyback this particular topic is very important. And that's why the possible intersection points would be the family and community medicine course, but they have a lot of topics on their plate already. And I believe that the practice of medicine is the perfect integration point of health informatics, health information technology topics such as this one. And to answer your question directly, yes, we have to schedule a specific time slot. I have to talk to the coordinator to really fix the time frame and the logistics that will be used for the activity. And that will be part of the development of their syllabus for the upcoming school year. So the commitment of the course coordinators is very important. And while it is not still finalized as of this point, it will be finalized once they write and finalize the syllabus. But I'm very optimistic that I got their commitment for next academic year.
Adding to the same question, I want to ask like how will you will manage the experts? So maybe a group of experts will be teaching the course, or you will be telling some one of the expert to teach this type of course,
So right now,
this type of model.
so right now it's still we have a few faculty which are um geared towards health information technologies, health information systems. Um, as far as the prioritization of the curriculum, it's not really it doesn't have a lot of prioritization, so to speak. So that's why right now the main push still comes from my end, and of course, if it gains traction, hopefully we get to have more faculty involved in the development of the course. Hopefully, it expands, and depending on the needs of the college, and also depending on the needs of the medical curriculum in the Philippines.
Best wishes, Dr. Julius.
Thank you so much.
Yes, thank you, Professor Basanta. Before we proceed to the questions in the chat box, maybe we can also call on Professor Lukman for his reactions. I think he's unable to unmute his mic, Dr. Julius, but he's asking any possibility to teach about interoperability using openIMIS.
Most likely, the interoperability can be used. OpenIMIS rather can be used to teach interoperability, but I would imagine, of course, I'm not the expert on this, but it could be used as one of the health information technology systems um, to teach interoperability. But most likely, you will have to use other platforms. Um, yeah, you have to use other platforms if you want to test or teach about interoperability.
Yes, thank you, Dr. Julius. We can proceed to the questions now. I think Dr. Aminul is raising his hand. Dr. Aminul, would you like to ask your question?
Thank you, Cha. So thank you, Julius, for excellent presentation. I was watching your presentation, and I have a couple of questions that arise in my mind. Maybe I missed something. So first of all, that the course that you mentioned, is it only offer in person, or in also e-learning also platform is available?
That's a good question. Initially, actually, the course, or at least the activity, I can't really call it a full on course, but the activity can be delivered either face to face, on site, or online. So we used online last time. This is mainly due to logistical issues, but and also accessibility issues, so that more participants can join in. But if it's formalized in the student setting, it can be delivered face to face. And initially, when we did our initial workshops way back in 2020, January 2020, we actually did it face to face, on site. But of course, the requirements there would be that your university or your program should have dedicated computer systems.
Okay, and then second question is it mandatory for the medical students that you mentioned, FCM and POM? Those are medical students. This is a mandatory course. They have to do it.
Which one is
This
the
IMI is the course.
oh, this one?
openIMIS.
Okay, so right now it's not mandatory. Our initial rollout for this one was through an elective course, the tropical medicine course that I mentioned earlier. It was an elective course because right now health informatics is not really part of the medical curriculum requirements in the Philippine program of medicine. So some schools teach it, some schools just teach it in passing.
And my
So
third question, sorry,
yes,
please.
go ahead. I'm done.
Another question is related to this, like most of the academic course, sometimes, as academicians, we don't have any end result or end point for why we are offering this course. I mean the country, perhaps the Philippines is, have a vision to scale up the insurance policy through this software. So do you have any alignment between the practical implementation and the course, that those are doing the course, that they have the alignment somewhere in future? Do you have that alignment in a rightly way, or I'm just, what is your plan? I was just a little bit
Yeah, so thank you
curious
for
to.
that. That's a very practical question. That's why when reviewing the original scenarios from the training manual, um, I felt that the scenarios were geared towards more towards open administrators, and that is why localization of the scenarios is very crucial in terms of what exactly do you need your students to learn. So that's a very practical question. And that being said, um, these particular exercises, at least the main goals would be to familiarize our students with how health financing works, the processes involved in health financing. And number two, to give them an idea on how health information technology works. And I believe there are a lot of other health information technologies that can be used, but openIMIS right now is very practical, it's very user friendly. And of course, we have partnerships with AHIN. And um, I guess what I'm saying is that the technology is there, and it also aligns with the goals of the universal healthcare law, which pushes us to digitalize our health records already. And at the very least, openIMIS would give the students a taste of how to use health information technology. So I think it aligns well with with the universal healthcare law that our country is presently undergoing right now.
Thank you very much. Thank you.
Thank you.
Yes, thank you, Dr. Emil and Dr. Julius. We also have a question from Dr. Cherry Bernardo Lazaro.
Oh.
Thank you for your lecture, Dr. Julius. I just want to ask if there are stakeholders outside SBU who expressed interest in openIMIS, and have you engaged stakeholders outside medical education like communities working with SBU?
Okay, thank you, Cherry, for your question. So actually, I know Cherry, but ASM, Ateneo School of Medicine and Public Health, at least on the student side, have expressed interest in using openIMIS as well. And there are also other Philippine country hubs. We've Of course, we have Dr. Eloy Marcelo here from UP, um, and representatives also from UP Silab. There are also from St. Luke's College of Medicine. So outside of San Beda, there are interests here in the Philippines as far as academic incorporation of openIMIS is. Now, as far as outside medical education, our initial plan before the event, the pandemic, was to actually use openIMIS, or at least a similar technology, as a training tool for our students. Once our we have a big plan in the creation of a community health center within the university. So we were planning, at least it was part of the original proposals, to include openIMIS and similar technologies, including dedicated electronic health records, to be part of the community health center as part of training, and also to serve as EHRs and health information technology in the service of the community health center. So, but right now, as far as our activities are concerned, openIMIS utility would be limited to those.
Yes, thank you, Dr. Julius. We also have some questions from Dr. Alvin in the chat box. So how did the SBU Academic Committee receive the course? What were the questions when you presented it the first time? And will you use the openIMIS demo server supported by GIZ, or do you plan to host your own server later?
Okay, so as I very very similar or related to the last statement that I made, um, every year we pitch this to the administration. Um, I want to be diplomatic with my answer, but um, let's just say that sometimes the priorities are, of course, not in health informatics, and I would understand because health information systems, because I would understand that it's not, as I mentioned earlier, as I keep repeating, it's not really part of the competencies, at least very directly stated in the Commission on Higher Education program for medicine here in the Philippines. Now, that being said, um, the 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 administration is already familiar with the proposals, but we will be pushing the proposals every now and then, every year at the very least. As far as incorporating openIMIS to have a local server at San Beda University, it was also floated with administration with the administrators. But the questions and the barriers that we encountered during those discussions would be, of course, logistic issues, the need for information technology personnel. So these are the questions that were floated during those discussions. At the very least, the discussions still are in the early phases, but hopefully, if and when the community health center becomes functional, the discussion would push through more rapidly. But of course, here's to hoping.
Yes, thank you, Dr. Julius. I think we've reached the top of the hour. Once again, thank you for the presentation and for proactively answering the questions of our participants. We would like to thank our participants and other focal points as well for actively participating in this session. Before we go, we would like to invite everyone who can turn on their cameras for a group photo with Dr. Julius. All right. Thank you, everyone.
Thank you very much, everyone. Thank you, Chat. Thank you, Christine.
Thank you. Bye bye.